All right, so we're going to go ahead and get started with chapter 11. So we just talked about muscle tissue. Now we're going to talk about the muscular system. All right, so we talked mostly in chapter 10 about cells and tissues. Now we're going to talk more about the whole system. All right, so things that we're going to be covering. I'm going to cover some definitions. All right, like parallel muscle, body, convergent muscle, raphe, pinnate muscle, circular muscle. We're also going to talk about levers and fulcrums, origins and insertions, actions. We'll talk about what a prime mover is, as well as an agonist or antagonist, and synergist. We'll also talk about characteristics and examples of first-class levers, second-class levers, and third-class levers. Talk about the functions of the axial musculature and the appendicular musculature. Okay, sounds like that has something to do with the axial skeleton and the appendicular skeleton, right? All right, you're going to be able to finish this sentence. Levers can change something. And then we'll finish this next sentence. Name of a muscle may include information about its blank. We'll know two factors that determine the effect on skeletal muscle contraction. And so, hint, hint, there are the anatomical arrangement of muscle fibers and the way that a muscle attaches to the bones. Okay, that sounds like a pretty good short answer question there. Also, you're going to need to know these medical terms for matching. Okay, hernia, intramuscular injection, compartment syndrome, and ischemia. Okay, so I'll give you a little overview there. All right. So again, these are some of the terms that we're going to have to learn. Okay, we just went over the names of these just now. All right. So muscles can exist in certain patterns. There are 4 of them. They can be parallel. If they're fascicles, remember fascicles? Okay, in terms of levels of organization, bundles of fibers. If those fascicles follow the long axis, it's a parallel muscle. And the central area of a parallel muscle is known as the body. Muscles are said to be convergent if the muscle fibers cover a big area, but they start coming together at one point. Okay, another term you need to know based on convergent muscles is the raphe. It just means you have a slender band of collagen fibers. Okay. Now, third type of pattern are the pinnate muscles. And here the fascicles are going to go at an angle with the tendon. And then you have circular muscles. Example of a circular muscle is a sphincter. And here the fibers are going to go around in a circle. And when they contract and close things up. Okay. All right, so we're going to talk about classes of muscle fibers, or actually classes of levers, excuse me. So in order to do that, we kind of have to give you some background information. So a lever is just a rigid structure, okay? And a fulcrum is a fixed point that moves. Okay. Now you might say, well, this is anatomy. This isn't physics class. Well, when we're talking about motion, motion is also physics, right? So there's a little physics involved. Actually, a lot. So more terms, you have the origin, which is a fixed point of attachment of muscle to bone. And then you've got an insertion, which is a movable point of attachment, okay? So in order to have movement, your muscles have to attach to the bone in at least 2 places, okay? And one of those points is said to be fixed and the other is said to be movable. And action is a movement produced by muscle contraction. So in lab, you're gonna have to do a video where you have to explain the origin and insertion and action for 5 muscles, okay? We don't make you learn the origin, insertion, and insertion for every muscle that we teach you, but you are gonna have to learn it for 5 muscles, okay? That you choose. Okay. More terms related to how muscles contract or how they move. So you have the prime mover or the agonist. So the prime mover is the primary muscle responsible for a certain movement. The antagonist is going to oppose the movement of the agonist. Another way of saying that is the muscle that produces the movement that's complementary to that of the prime mover. Synergist is then a smaller muscle and it assists the prime mover. So there's some synergy between the synergist and the prime mover. All right, we'll check for understanding here. So in blank muscles, the fascicles follow the long axis, okay? All right, parallel muscles, good. In blank muscles, fascicles go at an angle with the tendon. Okay, very good. A blank is a fixed point that moves. All right. A blank is a fixed point of attachment of muscle to bone. Okay. A blank is a movement produced by muscle contraction. Okay. A blank opposes the movement of the agonist or prime mover. Okay. A blank is a smaller muscle that assists the prime mover. Synergist, yes. All right. So let's talk about levers. It can be first class, second class, or third class. So with first class levers, this is like a seesaw. Okay, that's an example. And here the fulcrum, remember that's a fixed point that moves, lies between the applied force and the resistance. All right, you say it, example of that's your neck, and we'll show you that in just a minute. In a second class lever, think of this like we go to a wheelbarrow. The resistance is actually between the applied force and the fulcrum. And we'll see that in the calf muscles as well as your ankles when you're extended. So third class levers, this is what you see most often in your body. Your applied force is between the resistance and the fulcrum. So it's the reverse of what you see with the second class lever. An example of that would be your biceps brachia. Okay. So before we do this, we're going to check for understanding. Pull this up. So there's your first class lever. Here's your fulcrum, kind of base of your neck, back of your neck rather. Resistance, okay, think of it as like pulling the front of your face down. That's your applied force, okay. You're also, in a sense, trying to move the muscle so that your head goes down. So your fulcrum is in the middle. And so, and a better way of saying that is, here's what the muscle, here's the movement we're trying to get to. So your head's down, and then you're trying to, so your neck is flexed, and then you're trying to extend it back. So when you extend it, the applied force is down. The resistance here is gravity, which is opposing your applied force. Okay, it's also trying to pull your face down. But you have to apply enough force to overcome gravity. Okay, but here's the fulcrum. So that's a first class lever. Second class lever, now the resistance is in between your fulcrum and your applied force. So when your gastrocnemius muscle in your calf contracts, okay, it's in a sense pulling your body up, okay? Your fulcrum is at the ball of your foot, okay? Resistance is at the base of your foot, pulling your body down, okay? So resistance is in the middle. All right, so that's a second class lever. So if the fulcrum's in the middle, it's a first class lever, F, F. All right, if the resistance is in the middle, it's a second class lever. Now for a third class lever, the applied force is in the middle. So here's your fulcrum, is your point, fixed point that moves. Okay, your resistance is what's in your hand or your hand itself. Okay, applied force is in the middle. Okay, trying to make your biceps muscle contract. All right, so if the fulcrum's in the middle, it's a first class lever. If the resistance is in the middle, it's second class lever. Applied force is in the middle, it's third class lever. Okay. Just on a related note, if this is the movement, is this the prime mover or the antagonist? Biceps brachia. It's the prime mover, right? Because it's doing the, what is going to be your antagonist? Anybody know what this muscle is called? Triceps brachia. Yeah, that's your antagonist. Okay. All right. All right, in a blank class levers, check for understanding. Resistance lies between the applied force and the fulcrum. So the resistance is in the middle, it's a second class lever. Blank class levers are the most common in the body. Third, very good. The neck is an example of a first class lever. Good. All right. Functions of the axial and appendicular musculature. So for the axial musculature, it serves to position your head as well as your vertebral column. Okay, keep your head and the vertebral column in place. Also can move your rib cage when necessary. And forms the pelvic floor. Okay, those are the functions of the axial musculature. Now, what about the appendicular musculature? So This set of muscles moves and supports your pectoral and pelvic girdles in your limbs. So that should make sense because those are the parts of the axial skeleton, right? And the axial musculature function should make sense because you have your head, right? Your vertebral column, rib cage, those are all parts of the axial skeleton. Okay. Remember I said you have presentation, or if you have a sentence you have to complete, levers can change, ... So you could see a question, what are 3 things a lever can change? Or what are 2 things a lever can change? Okay. And you would tell me that levers can change the direction of an applied force. Okay. Levers can change the distance as well as the speed of movement, how fast something can go and how far it can go, and the effective strength of that applied force. Okay, so direction of applied force, effective strength of that applied force, and the distance and speed of movement. Okay, those are 3 things a lever can change. All right. Okay, another sentence you're going to have to finish or provide answers for are, what can the name of a muscle tell you about it, that muscle? And so you may have to provide some set of these. Okay. Won't tell you how many, so just generally just know them all. All right. But the name of a muscle can or might be able to tell you information about its location, like where it is in the body. Might tell you something about the origin and insertion points. Might tell you how the fascicles are organized. Might tell you the relative position of the muscle. Could tell you structural characteristics. Could tell you the action of that muscle. Okay. All right. Check for understanding. So this one, I'll let you all talk amongst yourselves. What's the function of the appendicular musculature? Okay, so let's go ahead and talk with your partners on this one. Oops. No. All right. Just a moment. All right, so the function is to move and support your pectoral and pelvic muscles as well as your limbs, or pectoral and pelvic girdles and limbs. All right, what are 2 things levers can change? Okay, direction and speed, right, of movement. What else? Effective strength of an applied force, as well as there's something else of an applied force. Well, speed of movement, direction, and what? Direction of the applied force. Okay. So it can tell you the direction of the applied force, the strength of the applied force, and the distance and speed of movement. All right. What are 3 things you can determine about a muscle based on its name? Location is 1. Origin and insertion. The action. Fascicle organization. The relative position. Structural characteristics. What did you say? Action, okay. And location. Okay, very good. All right, here's another short answer type question. What are 2 factors that can determine the effect of a skeletal muscle contraction? And the answer would be the anatomical arrangement and the way the muscle attaches to the bones, okay? So how's the muscle arranged anatomically? How's the muscle attached to bone? That tells you a lot about how that muscle is going to contract. All right, another fill in the blank. Organization of skeletal muscle fibers is going to affect certain things like power, okay, depending on how those fibers are organized, the range of movement, so how much you can move that muscle, and the speed, how quickly you can move that muscle. So, and that relates back to what we learned in the last chapter. Anybody remember anything about different kinds of fibers? Anybody remember some of those fibers? There are certain names. There are 3 fibers that we learned about. Well, those are, yes, we learned about that in terms of like, yeah. So you have the elastic fibers, the collagen fibers, but those are really, when I said fibers, I guess that wasn't clear because you could be talking about the fibers inside of a skeletal muscle fiber, or talking about the different types of skeletal muscle fibers themselves. And that's really what I was getting at was, what is your organization of fast, slow, and intermediate, okay? Tells you a lot about, because again, if you've got a lot of fast fibers, you can have a lot of power, a lot of speed, okay? But if you've got a lot of slow fibers, you may not get as much power, you may not get as much speed, but you can sustain that movement longer, right? All right, so talk about some matching medical terms. So what's a hernia? So Oxford Dictionary defines hernia as a condition in which part of your organ gets displaced and it starts protruding through a wall of a cavity that contains it. All right, and this happens a lot when you have your intestines that hit a weak point in your abdominal wall, okay? Usually very painful, okay? All right, intramuscular injection. Remember, intra is within, okay? So this is Healthline defines intramuscular injection as a technique that's used to deliver medication deep into the muscles. That is helpful because it allows your medication to be absorbed into your bloodstream quickly. Okay, because you've got a lot of cardiovascular, capillaries that go to your muscle, right? So it can be absorbed quickly. All right, compartment syndrome. So WebMD defines compartment syndrome as what happens when excessive pressure starts building up inside enclosed muscle space and somewhere in your body. And it usually is going to result from bleeding or swelling once you're injured. So you get really, really dangerously high pressure, and it impedes blood flow to and from your tissues that are affected. Whereas ischemia, Oxford defines it as an inadequate blood supply to an organ or part of the body, particularly your heart muscles, okay? So even though your heart pumps blood, some of that blood has to actually go to the tissues, muscle tissue in the heart, and keep it going. And ischemia and compartment syndrome are not the same thing, okay? So ischemia just has to do with inadequate blood supply. Compartment syndrome, typically it has to do with high pressure, okay? And usually some injury, some swelling or bleeding, okay? And also there's impeding of blood flow both to the tissue and from the tissue. Whereas ischemia is inadequate blood supply to the tissue. All right, let's do a check for understanding. What are two factors that determine the effect on a skeletal muscle contraction? How what? Yes, the way the muscle attaches to the bone, and what else? Anatomical arrangement, good. All right, what are two effects of organization on skeletal muscle fibers? Range of movement, power, speed of movement. Okay, very good. Okay, a blank is a condition in which part of the organ is displaced and protrudes through the wall of the cavity containing it. Hernia, good. A blank occurs when excessive pressure builds up inside enclosed muscle space in the body. Compartment syndrome. All right. So good luck on your exam, okay? So I think you've already done your quiz 3, but good luck on your exam 3. That is actually chapter 11 in a nutshell, okay? So rather than do the traditional PowerPoint over the whole thing, I just figured I'd cover what I know you need to know for the exam, okay? So that is chapter 11. So we will actually start chapter 12 next week. So we'll be a little bit ahead in a sense, but chapter 12 is a lot. So it's a reason why it's on there for a week and a half. So we're gonna go ahead and get started on that next week. All right, we're gonna go ahead and conclude the video now.